This conference will now be recorded.
Okay, so good morning everybody. Today we will look into the irritant poisons. So we know that we have different types. We have corrosives, irritants, systemic, and then miscellaneous. Corrosives we have seen, and then in irritants we have organic irritants and inorganic irritants. In irritant poisons we have again these metallic poisons. So in metallic poisons we have arsenic, lead, copper, mercury, and then we have inorganic poisons where we have chlorine, phosphine, metals like that. So today we'll look into arsenic poisoning briefly. So these are some of the questions normally previously asked in the university examinations. They have asked about the difference between arsenic poisoning and cholera, and they have asked about what is the ideal homicidal poisoning. So arsenic is an ideal homicidal poisoning because it will mimic cholera. So that's why people, the doctors will think that the patient is suffering from cholera, and then he will treat in line with cholera, and he will completely forget about the arsenic poisoning. So that's why it is called ideal homicidal poisoning, where ideal homicidal poisoning is a poison where it will mimic a natural disease. If a poisoning is mimicking a natural disease in exactly the symptoms, then it is every chance that the doctor will miss the symptoms and then poisoning classification. And then baseline, and then how to collect a collection of samples in arsenic poisoning, or what are the samples that are collected in arsenic poisoning in order to detect the poisoning from the body, and then post-mortem inhibition of the arsenic, and then who are arsenophagic. So we know arsenic is in metallic form, is non-poisonous, and it is not absorbed from the GIT tract. So it is only in salted form that is absorbed. So in metallic form, it is non-poisonous because it will not be absorbed from GI canal. The compounds of the salts of arsenic are very poisonous, like white arsenic, arsine, and then Paris green. Paris green, otherwise called as copper acetoarsenate. So arsenic metal per se is non-poisonous because it is a metallic form. It is not absorbable from the GI tract, but the salts of arsenic are poisonous, like white arsenic, arsine, and Paris green. What is the mode of action of this arsenic salts? Is it acts on the SH groups of respiratory enzymes, sulfhydryl groups. SH means sulfhydryl groups of respiratory enzymes, and then it will block the action of these respiratory enzymes. So thereby this respiratory enzymes action is blocked, leading to interference with the cellular respiration is inhibited, and there is a damage to vascular epithelium. Vascular epithelium, mostly it is a capillary poison. So that's why it is called a capillary poison, because the respiratory enzymes are inhibited. It will damage the vascular epithelial flow. It causes local irritation of the mucous membrane, and then it causes depression of the nervous system. So this is the normal mode of action of arsenic on the body. So in acute poisoning, so the principal manifestation of acute arsenic poisonings are mostly GI symptoms. So I told you arsenic poisoning is an ideal homicidal poisoning because it mimics cholera poisoning. So what are the signs and symptoms? we have fatal dose of greater than 200 milligrams. So massive dose, if the massive doses are taken, means greater than fatal dose is taken, then we have a fulminant type of acute poisoning. And then if the fatal dose is taken, then we have this GI type, gastrointestinal type of poisoning symptoms will occur. So if the massive doses are taken, then death will occur, which is due to shock and peripheral vascular failure. So it is due to cardiovascular, mostly peripheral vascular, or it is mostly CVS. So vascular system failure is the cause for massive dose of poisoning, which is more than the fatal dose of arsenic, which is greater than 200 milligrams, and which is known as fulminant type. And then we have, if the fatal dose is taken, it is called the GI type or gastrointestinal type. So what are the symptoms if the GI type is there? Means you have sweetish metallic taste, there is burning sensation in the mouth, constriction of throat, there is abdominal pain, colicky abdominal pain, and then the esophagus, severe vomiting can be there. So pain is there in both the esophagus and the stomach. There is severe vomiting, and then purging, usually accompanied by tenesmus. This is very important. So vomiting, GIT symptoms, I told you there is severe vomiting, and then purging. Purging means it is an explosive diarrhea type. So purging, which is accompanied by tenesmus. Tenesmus means a feeling of pain and where a feeling of defecation, but with pain will be there, tenesmus. And then pain and irritation of the anus is there. And then rice water stool is very important. It is a classical of cholera poisoning. Classical of cholera disease. So rice water stool can also be there in arsenic poisoning. That's why it is very difficult to differentiate between arsenic poisoning and cholera poisoning. So we will know at the end of the this class how to differentiate between arsenic poisoning and cholera poisoning. And then the patient can also experience vertigo. Most GI symptoms are the patient can have vertigo. Symptoms have abdominal pain, and then severe vomiting, purging, accompanied with tenesmus, pain and irritation of the anus, rice water stool, and then we have metallic taste in the mouth. What are the characteristics of the stool? They are frequent, involuntary, and then dark colored, and later it can be it becomes bloody, but later it becomes colorless, watery, and resembles rice water stool. So mostly the stool will be involuntary, bloody, mixed with blood, and then after a few episodes of this diarrhea, it becomes a free fluid, watery rich diarrhea, which we called as rice water stool. Rice water stool where there are a lot of starchy substances. So rice water stool later, and then the start there will be diarrhea can be there. So this is the characteristic of in case of so what is the management of this case? Gastric lavage, and freshly prepared oxide antidote is BAL. BAL means we know that it is British anti-leucite, and then we can give purgatives. Purgatives like magnesium sulfate. So gastric lavage can be done in arsenic poisoning with lukewarm water and also by oxide, or we can also induce emesis. And specific antidote, we have antidotes. So Ball British anti-leucide is a specific antidote for arsenic poisoning. So what are the some of the symptoms of chronic arsenic poisoning? So where does the chronic arsenic poisoning will occur? Mostly in industrial workers, where there is chronic exposure to small amounts of arsenic salts in a prolonged periods, and then agricultural workers, prolonged agricultural workers, when prolonged with arsenic substances can cause chronic arsenic poisoning. What are the signs and symptoms? There can be non-specific and specific. Non-specific is the patient will have excessive fatigue and malaise, lack of interest and concentration, joint pains, loss of weight, constipation, and then loose motions. What are the specific symptoms? Specific symptoms are very important. We have abnormal skin pigmentation of the skin, which we call it as eczema arsenal. Abnormal pigmentation of the skin, which we call as eczema arsenical. And then we have alopecia, meese lines. Meese lines on the nails can be seen. What are these meese lines means? These are nothing but arrested growths. Arrested growths on the lines. So they are pale areas where the arrested growth lines can be seen. One of the symptom of one of the signs of arsenic poisoning. And then we have muscle weaknesses, muscle cramps can be there, jaundice, pruritus can be there, and then albuminuria. So excessive passage of protein in the urine can be there, and then wasting of the muscles is seen, and then bone marrow conditions where there can be aplastic anemia changes can be there. So externally, it is eczema can be there on the skins, mostly on the palms and on the soles. Alopecia, meese line can be seen along with other systemic symptoms like weakness, jaundice, albuminuria, and wasting. So this is arsenic poisoning where you can see there is thick eczematous-like conditions on the soles and on the palms. So these are the meese lines, white color things where it is due to arrested growths because of the inhibition. So what is a meese line? It is also called as Aldrich Mee line. It is the transverse white lines on the growing end of the line nail, and it is reported about 15 days after the exposure to the arsenic. It is about 1 to 2 mm thick and appears in same relative position in all fingers, and it indicates that the period of arrested growth of the nail, which is due to interference of normal metabolism. We know that arsenic interferes with the respiratory enzymes, and also it has some other enzymatic arrestation where we have known that it is a capillary poisoning. So any enzyme may cause a decrease in growth. So we can see this manifestation in the nails where there is arrested growth in the nails, and then it will appear as a white line. So it is about 1 to 2 mm thick, and then they are transversely present on the growing end of the nails, and it is due to exposure to arsenic. So what is the cause of death in this arsenic poisoning is liver failure, because mostly involves enzyme inhibition, liver failure, renal failure, and then toxic encephalopathy. Liver failure, renal failure, and toxic encephalopathy in case of chronic arsenic poisoning. Whereas in case of acute arsenic poisoning, we have vascular collapse, shock, and peripheral vascular collapse is the cause of death in arsenic poisoning. What are the post-mortem findings? Post-mortem findings, we have external examination and then we have internal examination. External examination, the patient or the person looks emaciated. Rigor mortis will start early in case of arsenic poisoning, and decomposition occurs late in arsenic poisoning. And the fecal matter is blood tinged. And then we can see meese lines on the nails. The internal findings are, we can see inflammation of the GI system. We can see ulceration of the stomach can be seen. So heart subendocardial hypertrophy can be seen. Lungs congested, liver and kidneys are degenerated. So these are some of the changes that we can see, mostly non-specific, except there is inflammation of the GI tract, and then we have externally meese lines, and then fecal matter blood tinged, and then rigor mortis, it will start early and decomposition will start late. So how to diagnose arsenic poisoning? The collecting samples. So if the patient is living, then we'll collect urine, stool, blood and hair, and nail samples can be collected. And one thing in arsenic poisoning, even in burial cases also, we can detect this arsenic poisoning, because hair and nails are some are the organs which decompose very late, even in buried bodies. So during exhumation, we can detect uh, arsenic poisoning even from the dead body after 6 months after he died and then buried. So dead bodies, all bone ashes, kidneys, liver tissue, mostly kidney, liver tissue may not be available by that time, but bone can be there, bone ash can be there, hair can be there, sometimes nail can be there, mostly in buried bodies. So if the body is cremated, burnt, then we may not able to get all nails and hair, but we can get the bone ash. If the body is buried, then we can get all nails, hair, and then bones also we can get. And some of the tissues like kidney, liver can also be gone. So whatever, so these are some of the samples we'll collect in order to detect the arsenic poisoning. And what are the tests we will do is Mars test, range test, and Gurje's test. No need to know what are the tests, how to detect. Just some examiners may ask the test what is done to detect arsenic laboratory in a forensic laboratory. Mars test, range test, and Gurje's test. So how to differentiate? This is a question most commonly asked in the university examinations. How to differentiate between arsenic poisoning and cholera disease. So first one, pain in the throat. It is present in arsenic poisoning. It is absent in cholera. Purging means diarrhea is following vomiting. Means in arsenic poisoning, first uh, vomiting will occur, then purging. In cholera, it is before vomiting. Before one means first purging will occur and then the vomiting will occur. So purging is following the vomiting in arsenic poisoning, and then it is before vomiting in cholera poisoning. Vomitus contains mucus, bile, and blood in case of arsenic poisoning, whereas in case of cholera, it is just watery fluid. The stool is dark rice water with the blood tinged is present in arsenic poisoning, whereas in cholera it is white rice water stool. Tenesmus and annihilation is present in arsenic poisoning, whereas it is absent in cholera poisoning. So analysis, we can know arsenic metal, it means laboratory test if done with the stool examination or with the urine, then we can get arsenic as a metal. And if we are taken the cholera stool, then we can get Vibrio cholera, which is the causative agent for cholera disease. So these are some of the differentiating features, how we can differentiate between arsenic poisoning and a cholera poisoning. So pain in the throat is present in arsenic poisoning. Purging is following vomiting, whereas purging is before vomiting in cholera. And then vomitus is bile and mucus. In case of arsenic, it is watery in cholera, and stool is dark and rice watery with arsenic, whereas in cholera it is pure rice water stool. The stool, if further if we keep on means after a few episodes of diarrhea in arsenic poisoning also rice water can, it is and blood can occur. Initially it is dark tinged. Tenesmus and anal irritation is present in arsenic, which is very important feature, is absent in cholera. So laboratory diagnosis, we can get arsenic from lab test and we can get Vibrio cholera from cholera. So this is the difference between arsenic poisoning and cholera. Very important, has been asked many times in examination. What is post-mortem imbibition of arsenic? Here, normally the soil contains arsenic. So sometimes the soil can imbibe the arsenic present in the soil into the body, in the buried bodies. So arsenic can enter through the skin from the soil, especially in the dead bodies in burial. The process is called imbibition. So imbibition means a process in which normally the soil contains all the metals. So arsenic is also found in high amount. So this arsenic, when the body is buried, can imbibe into the body through the skin. And then when we exhumate the body and then test for any arsenic poisoning, then it can falsely give that the person is suffering from, has died because of arsenic poisoning. So this is one entity we have to remember, imbibition. Imbibition, post-mortem imbibition of arsenic can be there, one entity where from the soil arsenic can enter the body through the skin. And then there is one more terminology called arsenophagic, where some people take arsenic daily as a tonic, as it has some aphrodisiac properties. So aphrodisiac properties, we know that aphrodisiac means which increase sexual gratification. They can acquire the tolerance up to 300 mg, and these people are called as arsenophagics. So arsenophagics are people who take arsenic metal as in the form of a tonic, which has the property of aphrodisiac properties, and then they can go up to 300 mg. Tolerance can also be, normally the fatal dose is 200 mg, greater than 200 mg, but these people, because they are taking daily, they can get the tolerance up to 300 mg. So these people are known as arsenophagics. So thank you very much. That's all. So arsenic poisoning, very important. So acute arsenic poisoning, chronic arsenic poisoning, we know, and then mesalines. What is the difference between cholera and then arsenic? And then what are the symptomatology of arsenic poisoning? And what are the changes that occur on the food? All these things have been asked in the examination. So thank you very much. That's all. That's it for today, and we'll meet in the next class.